Let's talk about implant crowns. So when you get an implant, there's 3 parts to an implant, and the surgical part is first, where the implant is put underneath your gums and you're never going to see that. But what you actually see and use is the implant crown. Now between the implant and the implant crown, there's a connector. It's either an abutment or a tie base, depending on what system you're using. So we can either restore implants as a screw retained implant crown or a cement retained implant crown. Now let's go through both of those so that we can see the difference between the two. The first one that we're going to go through is a screw retained implant crown. And when you're first looking at a screw retained implant crown, you can see that there's a little hole on the occlusal aspect of the implant crown where I can easily access and unscrew the implant. When I take the implant crown off, you can see that there's a screw coming out, and what that screw does is it engages the internal portion of the implant. So we put the implant in, we screw it in, and it's very easy to put on and off the crown. And this is actually my preferred method of restoring implant crowns when possible. The second type is a cement retained crown. So when we're looking at this crown, you can see that there's no access on the external portion of the crown. But when I remove the crown, we have what's called a custom abutment. And this is where the access to the implant is. So I can easily take off the abutment, and there's still a screw that engages the internal portion of the implant. But once the internal screw is engaged, then I cement the crown. This is Dr. Mustelier, and we'll talk soon.